I'm Dr. Christina Johns, Senior Medical Advisor for PM Pediatrics, and I want to say thank you to everybody for joining in our conversation about high fever over the last day or so. So many interesting perspectives that I really enjoyed reading them all. A couple of take-home points. One thing that we were referring to in our post is that high fever, in the absence of any other medical problems, is something that we don't get terribly concerned about. So if a child has a rash or is breathing hard or has a change in their mental status, of course, that's a different story altogether. If they have an underlying medical condition, well, that's a different story altogether as well. Febrile seizures or fever seizures happen when the rate of rise of the body temperature happens too quickly. It's a harmless phenomenon that we shouldn't get too worried about in and of itself. It doesn't lead to epilepsy or learning problems or any other difficulties. So whenever you have a concern as a parent about how your child is doing, well, of course, it's important to seek medical care at that time. But in and of itself, in an otherwise healthy child who is breathing right and drinking well and acting playful or just like themselves, then a high fever isn't a lot of cause for concern in a fully vaccinated child. Thanks so much for being part of this interesting conversation.